The standard treatment is called nasal continuous positive airway pressure, CPAP, CPAP. A mask or an interface is put over the nose. Air pressure is delivered into the nose, back into the part of the throat air passage that's collapsing, blows it open. It's like inflating an inner tube. So this simply opens the air passage and holds it open while you breathe. Does not breathe for you. Does not provide oxygen. It just provides room air, the normal air you would be breathing anyway, and it provides it, but it opens the airway. So the pressure can be a very little pressure that's required, or it can be a substantially higher pressure that's required. Everybody needs their own special pressure, and we have ways of identifying that pressure. Sometimes it's required to do in a hospital test. Sometimes it can be done with an automatic device called an auto CPAP. In any case, CPAP is standard treatment. Why is it standard treatment? Always works and never hurts. It's great. We don't have many treatments like that always work but have no side effects. Now that's a generalization. That it always works is not. It always does help, but there can be some side effects. You can have a runny nose, or you can have some air that gets in your stomach. Minor things that compared to the disease that we're treating, sleep apnea. Its cost is in line with a common disease that can be treated easily. So I think CPAP has reason to be number one, and it is number one right now. 90% of people with sleep apnea are treated with CPAP. If they're after they're diagnosed, of course, but it's the commonest treatment, and it's used so frequently because it always works and never hurts. There's a problem though, and that is that not everybody wants to have something hanging off their nose when they're trying to sleep, and this thing that hanging off the nose is blowing air into their nose and into their throat, and so it's a kind of an obnoxious treatment. You're tethered up to a machine on the bedside by a hose, and it can be poorly tolerated or completely intolerated by certain people. So it varies, but somewhere between 30% and 50% of people just simply cannot use this treatment or refuse to even try it. So while it's the standard medical treatment, it does have a problem in that the compliance or adherence to the therapy is not particularly good. It's low, and so people who may get a prescription for CPAP either will not fill the prescription, or they may simply take the device and it lives most of its life in the closet. So that is a feature that we have to worry about, and it really has important ramifications for the effectiveness of the treatment. And by that I mean the long-term expectation that people will have their sleep apnea treated, gone. If I give a prescription for sleep apnea, obstructive sleep apnea, and it's going to be CPAP at such and such a pressure, my hope is that not only will the patient use it and feel better, my expectation also is that I don't have to worry about these serious medical consequences that I told you about before. I don't have to worry that the patient's going to die in 15 years. I don't have to worry that they're going to have a heart attack or stroke. So it turns out that I really should be worrying, though, as a physician, because CPAP is not because I can't be confident that CPAP is going to be used by the patient.